I went to a 4-H shooting sports morning early January of 2014, and I had the classic kind of chest compression and just didn't feel that well. So I stopped by the clinic, and the attending person at the clinic said, "Bob, I think we ought to have you be checked out from the hospital." And I said, "Okay, I'll drive from the hospital, the clinic to the hospital." "Oh, no, you won't. You need to have someone take you." Found that I had some elevated enzymes. So next thing I knew, I was traveling in a Brookings Health System ambulance down to Vera Heart and had emergency procedure to put stents in my heart, blocked arteries. I had 2 different stent operations in 2014, in January and then again in September. They were able to open that totally occluded artery, which made me joyful. I started taking more meds. I take some heart meds, but I have felt great, and in some ways it has had almost minimal impact on my life. For a while I ignored classic signs, and I would say that if someone else thinks they have these signs, pay attention to the signs. In my case, I had to acknowledge that I was getting older and there was some heart history in my family. So here was a chance to follow through on knowledge that I had. I'm glad I did. 2014 and 2015 were challenging years for our family, for me. But along comes Dr. Holm and the study, and I tell him my story, and he says, "You need this." After having gone through the first set of lessons, I totally agree. I do need this, and I am committed long-term to apply the lessons of balance and exercise and strengthening, appropriate diet, and a regimen that is heart healthy. And I think these things working together are all part of God's timing to help me live a life that's full and meet the needs of my family and friends.